I'd like to welcome you all for watching my video and thank you as well. My name is Santiago Elizondo and today we will be talking about physical therapy. This video will basically be a tutorial covering a day at the physical therapist's office after having knee replacement surgery. The picture on the screen will now show a before and after picture of what your knee would look like before and post surgery. As you can see, the bone has been replaced, and we won't go into much detail about this, but here's a little picture of what your knee would look like after having knee surgery. So now that you know what the total knee replacement surgery will look like after having it, we can kind of start going over the rehab process and what you should expect from your physical therapist. In this particular image, you can see the physical therapist as he has his hand on the knee. Basically, what he's trying to do is mobilize the knee. He's trying to move the knee. So we see this happening, and a common question through patients and just anybody would be like, why are you performing this? And to answer the question, basically what he's trying to do is when you bend and straighten your knee, like if you're walking, it can get stuck because the knee is only moving up and down. So what he's basically trying to do is get the knee mobility from not just up and down movement, so that way it won't get stuck. So following that technique, now that we got the knee kind of moving and got some mobility in it, we can go ahead and start on like exercises and stuff. One of the more common exercises would be leg raises. Simply, the patient would scoot to the edge of like a chair or a bench or area. The patient would then now have his legs hanging off of the bench or chair and try to raise or her leg for X amount of seconds, usually like 5 to 10 seconds, as straight as she can. Or once the patient has performed this and starts to get good at this exercise, the physical therapist can do many things to try to strengthen the movement and make it a little bit harder. One of the things would be adding weight to this exercise. You could add an ankle weight, like 1 or 2 pounds, and then perform the same exercise. That way we get the legs stronger. So another exercise and movement we can start doing would be with the bicycle. The bicycle, we can do many things. We can either pedal forward, we can pedal backwards, we can also have the knee that had the total knee replacement, we can have it do some resisting as well. In this picture, we can see many exercises for the knee. These exercises are considered level 1 and pretty easy for someone who hasn't had the knee surgery, but for someone that has had the knee surgery, these are the exercises that you would see early on in your rehab process. We can see the patient here performing an exercise. This exercise is commonly known as step-ups or walk-ups. Basically, the patient would have to step up onto some elevated surface as a block or a chair of some sort. In doing so, this would strengthen the knee and improve its mobility. This could help the patient with everyday activities, like if you're walking upstairs to your bedroom, something similar to that activity. This machine here is often used in the physical therapy field. It is known as an EMS, or an electric muscle stimulator. If you have not experienced one of these machines before or have no prior knowledge to what the machine actually does, don't worry about it, because I will soon be going into detail on how it works and the purposes it serves. There are pads that come with this machine. You would place the pads onto the patient and to treat the injured area. The pads are wired to the machine and will send an electric signal to that area. There are different currents that can be used to treat these muscle pains or spasms. So what happens is that the stimulation blocks the patient from perceiving the pain. It'll send continuous electrical bursts aimed at the area, causing the muscle to contract and relax. This will ultimately enhance muscle strength and recovery. So these last few pictures that will conclude this video will be of ice packs and also the newer model ice wraps or sleeves. Icing is an important part of the rehab process. Ice initially constricts local blood vessels and decreases tissue temperature. Overall, ice will 1. Decrease inflammation. 2. Decrease the pain. 3. Speed nutrients to the area. 4. Promote healing. 5. Decrease swelling. 6. Decrease tissue damage. And 7. Decrease muscle spasm. Although it will not feel good, it is far more beneficial than if you were to apply heat to the injured area. Heat does not give you the same benefits as icing would. Heat tends to feed the pain and inflame it. So this will be my tutorial over the rehab process after undergoing total knee replacement. I hope that you all have found this video interesting and informational. If you have any comments or questions, don't hesitate in asking. Once again, I would like to thank you all for watching and take care.